Hello friends, I'm Dr. Priti Savardekar, practicing as a dermatologist in South Mumbai for the last 18 years. Today we are going to be talking about pigmentation. The skin, as you all know, is a large organ covering our body from our head to our toes. The first thing that anyone notices about us is our skin and hair. As we all get older, our skin shows changes because of sun damage, because of aging, because of hereditary or genetic changes, and it's important to take care of them while we can. Pigmentation has different types, and I'm going to be talking about the type of pigmentation, how it is caused, what you can do to prevent it, and how it can be treated. The simplest pigmentation that we all see is called tanning. Tanning happens from sunlight on our sun-exposed skins, and it's usually seen on the face, in the forehead, and on the sides of the cheeks. It can also be seen on the arms. And the way to take care of it is by doing glycolic acid peels. You can do different types of chemical peels. You have topical applications. You can do lasers to lighten the pigmentation. And the way to prevent it is by putting sunscreens. The other type of pigmentation commonly seen by most of us is freckles or lentigines. These are small black dots which you see all over the face, usually on the T-zone, and they're usually hereditary again or genetics, and they come with the people who have more fairer skin. These again can be removed with electrocauterization. You can do radio frequency, and you can do Q-switch lasers. The way to prevent them is, of course, by putting sunscreens every 2-3 hours, every time you are in the sun. But yes, if it's hereditary, it's not very easy to prevent them. You can lighten them to about 70 to 80%, but 20% will always stay. The third type of pigmentation that we have is called melasma. Melasma, or also known as the mask of pregnancy, usually is associated with hormone changes in the body and comes after pregnancy and after menopause. It's usually taking the malar areas of the face, the forehead or above the eyebrows, the nose, and around the mouth. Now, melasma is related to hormone changes in the body, and hence very difficult to treat because you can't change your hormones as we age. They're going to change with our age, and hence it's good to lighten them. It's easy to lighten it to a certain extent, but the maximum part you have to stay with it, accept it, and maybe camouflage it so that it doesn't show and that you don't feel uncomfortable. There are lots of other types of pigmentation which occur on the face and the body. One of them being macular amyloidosis or bathing brush dermatitis. A lot of people get this rippled wave-like pigmentation on their arms, on their neck, on their legs, and this can happen with bathing brushes. They're using loofahs to have a bath, or they're scrubbing themselves too much. And of course, the ones who haven't been using it are getting it with stress or heredity again. There are other types of pigmentation which need to be diagnosed, confirmed with the skin biopsy, or you have to visit your closest dermatologist to understand what they are so that we can treat them best, because they would need a long-term treatment. I hope you have found the video useful.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.